If young people don't already know, when they get organized and come to their state legislators with an issue they want addressed, it has more power than almost any other form of advocacy in the state house. If you start speaking up at a young age, you practice a really important skill, which is not only building confidence, but the ability to speak across differences in a way that you reach people who didn't have your same lived experience. There is no shortcut to being able to communicate well with other people than to see what resonates, what is heard, and how you listen and hear other people and integrate their experiences and needs into your framing of issues, your advocacy, your political and social and leadership empowerment of others. So, for young people, I would just say, stay in conversation, engage in respectful and civil debate and disagreement. We often now think that if you disagree with somebody, you're done talking to them. You can't be in relationship with them anymore. That should be the last tool we use in the toolbox, is to withhold our friendship and our relationship from someone, not the first tool that we use. You can love someone, you can care about them, and you can disagree. And that means when both of you move to a place where you might be willing to listen and find common ground, you're still in relationship with each other. I'm still working on an environmental health policy for the state of Vermont that I first introduced 15 years ago as a senior in college. And I think for so many young people working in youth substance use prevention or any kind of health and well-being effort, it's important to start thinking about who's left behind, who doesn't have the time in their day, the financial resources, or the geographical space to access health and well-being. It can have so much to do with whether you have green space near you, or sidewalks, or a break between your jobs to meditate or to experience fresh air. And there's also systemic ways that people end up with black mold in their basement, or more heat vulnerability in hotter summers, more flooding and cold vulnerability in colder winters. And so I've been working on rebalancing our health conversation for over a decade in the legislature. For a long time, because we're such a green state, people called it a solution in search of a problem. We don't have that issue here. And I realized that people are moved in different ways. Some people really like facts and statistics. They want to hear something like 8% of Vermont's population live in mobile home communities, but they made up 40% of those affected in Tropical Storm Irene and other flood events. Some people are moved by storytelling. Let me tell you about a family in Newport that heats their home with a space heater and their stove. Some people are moved by the idea that something is right or wrong. Everyone should have access to environmental health and well-being. Everyone should have access to fresh air and open space. And some people are moved by a more emotional appeal. If you feel like you enjoy those things, shouldn't everyone be able to enjoy those things? And so I would offer that to young people, because sometimes they might feel like they failed because they didn't convince someone of something. And it's less about what convinces you and more about what convinces other people to act. And it can just look different. It can rely on different arguments and different types of advocacy. You might not be the right messenger. I've had to rely on a lot of other colleagues who come from more rural parts of the state to say, this is a problem where I am too. And so I hope this year, 15 years after first introducing the bill as a college senior, the bill will finally pass. We have a lot of hope and belief that it will. But I just want young people to know change is extremely slow, and it takes a lot of time and strategy to convince other people to make a change with you. That doesn't mean it's not important. So first of all, if I learned that someone wasn't resonating with the message that I was offering, I'd think, do I need to reapproach how I engage with them? Do I need to leave them be for a while and go work on advocating with somebody else? Or do I need to find another messenger? And those are the things you might have control over. What you don't have control over is that it might not be the right time for the bill. It might be that we need more examples from other states. It might be that it gets adopted at the very local level, or it becomes a conversation that builds from the ground up. And then one day you have enough advocates around you, you have enough organized groups of low-income people and people of color to say, this is a problem and we need support. And then the work can happen. People might look at the first woman of color to serve in the state Senate. They might look at me and think, she has a lot of power. But really, the power lies with everyone outside of the state house, everyone outside of the policymaking process who says, we're here to tell you this is a priority for us. If young people don't already know, when they get organized and come to their state legislators with an issue they want addressed, it has more power than almost any other form of advocacy in the state house. We are very sensitive to the idea that young people are our future and that we need to be listening to them because this will be their state soon. It already is. And I sometimes worry about calling young people our future without acknowledging that they're our present. They are breathing the air right now. They are deciding what kind of future they will have. They are behaving in healthy ways or learning, poor habits from us as adults. And so, we have to be in relationship with our young people. And when they tell us they really need something from the state, we do our best to listen. And it changes the course of history and the course of our policy decisions. We should always be looking for who is left behind. Who are we not communicating well enough with? If the pandemic has taught us anything, it's that we have deep disparities in Vermont, where people of color get left behind, low-income people get left behind, people with disabilities, people without internet access get left behind. People who don't speak English will get left behind. And so any advocacy you engage in, the best, most dynamic thing you can do is look around and say, who's not at the table? And how do we get them here? And then how do we reset the table so that it's a comfortable place for everyone to make decisions together? When I was in high school, I considered myself a pretty big activist. If I saw a problem worthy of solving, I really wanted to get in, get organized, and use my voice. And at the same time, I looked around at my campus of 4,800 students, and a lot of kids who might be taking the bus 2 hours each way from Compton. We couldn't wear solid colors like blue or red in high school because of gang violence. There was a lot going on for students. And so my advocacy around smoking on the beach, might not have been the biggest thing that was going on for students at the time. They were dealing with, an experience maybe in Los Angeles where just breathing the air can be equivalent to smoking 2 packs of cigarettes a day in certain places. So we really had to make these issues relevant to more young people. Often what that means is connecting it to their experience of trying to be at the beach or trying to be outside and, how safe they feel, how much they feel like they are sitting on cigarette butts or, dealing with different toxins in their immediate environment. We were working to end smoking on beaches. And this was Santa Monica was going to be the first beachfront community in the country to implement that ban. It felt important to me for the environmental reasons, but it was important to other people, for a variety of reasons about what it meant to be around smoking on the beach. What I would say, and I often reflect on this with young people particularly, is you still have to look around and think of the unintended consequences of doing something like that. It felt like a huge victory to ban smoking on the beach. And often with moments where you criminalize a behavior or make a behavior punishable, you end up ensuring that certain people will be punished more or will experience more of the impact of that change. There are, other disparities that exist within policing, within public safety measures, within health measures that mean that, certain people are going to feel a different impact from something we thought was a great victory for health and the environment. And what I mean by that is that after the ban passed, it was really a lot of homeless individuals, people who didn't have a clear housing situation, or people with mental health issues, people of color who ended up very visibly being the ones impacted, told you can't be here, you can't smoke here, take your stuff and leave the beach. That further removed them from the community and removed them from being able to experience the benefits of being in an outdoor space with recreation. If you had money, if you could sit at a cafe on the beach, you probably weren't going to be bothered about smoking. You're spending money and no one's going to bother you about it. So that isn't to say you shouldn't fight for these kinds of changes, but you should make sure that when they're implemented, it's done in a way that's fair to everybody. Because otherwise, you push people further and further away from the things you're fighting for. They think, there are those environmentalists pushing certain people off the beach. There are those, substance use advocates, who are trying to prevent substance use, but are at the same time letting people with mental health issues fall through the cracks. We need to make sure that if we work on these solutions, we empower people to be part of the change rather than the change happening to them. We should go through life assuming that people really want to do the right thing. They want to stay healthy. They want to experience wellness. They want to be in solid relationship with other people. And there are a lot of factors from childhood onward that make that experience hard, that make people think they need to rely on some kind of addiction to get through their day. And we all have some of those addictions. Some addictions become a disease. They become an experience that we have a hard time getting away from, even when we want to. And so the more you can do to have compassion for people who are in that spiral of experiencing the disease of substance abuse, the more your solutions will be built on what works for them and not your beliefs about what they should be doing differently. And I think that is a really critical lesson we try to return to in politics and lawmaking, is that unless we make solutions work for the people who are impacted, then we're not going to move the needle. And so you look at tobacco and cigarette use, and we have really moved the needle for higher income people, for young people in a lot of ways. But people who are low income and suffer from mental health issues, we haven't found those solutions because they're probably more expensive and more complicated that help them turn to other supports than the crutch and the disease of substance use. And so we have to be thinking all the time, who's left behind in our policies and how do we ask them to be part of building solutions with us rather than assuming we know what's best for other people. I mean, this was Los Angeles, so they had people who'd been in smoking commercials, talking about how awful it can be to smoke, who had voice boxes in their throats, I think in their trachea. They had people who were recognized as leaders in anti-tobacco and anti-smoking efforts. That was exciting, but I don't think it would have passed unless young people were at the table wanting this change. Like I said, when young people get organized, they have a really powerful voice. They have, in the pandemic, even in Vermont, you've had young people say, no one should be homeless. Everyone should have access to a house if they want one. When you present that kind of clear, moral language to a group of decision makers, it's really hard to argue with. And so, there were a lot of young people who agreed with me that there was an environmental impact, that we had grown up with the beach as our playground, and we didn't want cigarette butts on our playground. And so often I think what can change the conversation is recognizing that, young people are closer to the ground. They're, little kids digging in the sand, eating whatever they pick up. And we should be really thoughtful about any kind of pollution or any kind of toxin that's in our environment because of its impact on younger kids. That really resonated with us as older kids, to think about what our life was like when we were little and how to make that better. By the time I was in high school, many of us had experienced, drug dealing. We had experienced, people trying to pull us into some really bad habits. We had experienced violence when people were on drugs. Really, really terrible situations. I lost the friends, who died from, getting in fights with people who were using substances. It makes you less of who you want to be. And it leads to some irreparable, harmful decision. So we could see that by the time we were in high school. We were a little too seasoned and wise for our young years. But we turned around and thought, I want our younger siblings, our younger kids in elementary and middle school, to have a little bit of distance from those experiences. When I think of the issue of menthol cigarettes right now, and looking at how 90+% of menthol cigarettes are smoked by people of color, when we look at the advocates for that, it's a lot of young Somali Bantu women. They're such incredible advocates. They inspire me because they're saying, I saw this habit develop for my uncle who has lung cancer, and that still seems like such a faraway experience that I'm seeing it develop with younger people in my community too, who, just are at an age where you don't think the bad parts of substance use are going to affect you. And then you later in life regret it. So, we have to be bridge builders to help people at all ages understand that you can, be cool, you can be involved, you can be a leader without substances, without doing what you see adults do that later is going to cause them a lot of pain and, a lot of suffering. But we still get drawn into the cool parts of that. And it's really up to people who are at a really cool age, who are on TikTok, who are, very hip young people, to help deliver a very creative and often sophisticated message that's different about other cool things you can do that don't involve hurting your body.